Did you know that chronic inflammation can silently wreak havoc on your kidneys, leading to severe damage and health issues? In this video, we'll uncover the hidden dangers of inflammation, particularly for those with chronic kidney disease, CKD. We will reveal powerful foods, supplements, and home remedies that can help you reduce inflammation and support kidney health. From understanding the difference between acute and chronic inflammation to discovering the best anti-inflammatory diet tips and supplements, this video is packed with essential information you won't want to miss. Stay tuned to learn how to take control of your health and protect your kidneys naturally. What is inflammation? Inflammation is the body's response to injuries or infections. While it's a natural and essential process, chronic inflammation can lead to severe health issues like heart disease and kidney damage. Types of inflammation. Acute inflammation. This is the body's immediate response to an injury or infection, characterized by redness, swelling, and pain. It usually resolves once the body heals. Chronic inflammation. This is a prolonged inflammatory response that can last for months or years. It often leads to various health problems such as rheumatoid arthritis, heart disease, and chronic kidney disease, CKD. Symptoms and testing. Common symptoms include persistent fatigue, fever, and body pain. The HSCRP, high-sensitivity C-reactive protein, test can measure inflammation levels in the body. Why chronic inflammation is common in CKD. Factors like anemia, uremia, high levels of waste in the blood, and poor nutrition contribute to chronic inflammation in CKD patients. Contributing factors: infections, exposure to toxins, lack of exercise. Malnutrition and protein intake. Malnutrition, particularly inadequate protein intake, is linked to chronic inflammation. CKD patients must carefully balance their protein intake, avoiding inflammatory foods. Processed meats, deep-fried foods, and high-fat foods can increase inflammation and should be avoided. Diet tips for reducing inflammation. Antioxidant-rich foods. Include plenty of vegetables, fruits, and healthy fats in your diet. Focus on low-potassium options like berries and red bell peppers. Healthy fats. Use sources like olive oil and avocados. Fatty fish, salmon, mackerel, and sardines are great choices for their anti-inflammatory properties and high-quality protein. Baking soda. Some studies suggest it can help by alkalizing the body and lowering serum potassium levels, potentially slowing CKD progression. Turmeric, the active ingredient, curcumin, has strong anti-inflammatory properties and can help reduce kidney damage. Turmeric and resveratrol. Both supplements have anti-inflammatory benefits. Resveratrol, found in grapes and blueberries, it helps reduce inflammation and supports heart health. Caution with supplements. Always consult a doctor before starting any new supplement, especially if you're on blood thinners. Choose reputable brands and follow the recommended dosages. Case study. There have been cases where incorrect vitamin supplementation led to kidney failure, highlighting the need for caution. Risks for kidney disease patients. Excess vitamins can be harmful, especially for those with kidney disease. Specific vitamins to watch. Vitamin D. Overdose can lead to high calcium levels, causing kidney damage. Vitamin B12. Prefer methylcobalamin over cyanocobalamin to avoid potential kidney risks. Vitamin E. Opt for natural sources like sunflower seeds instead of synthetic supplements. Avoid vitamin supplements. Even small amounts can harm the kidneys, so avoid multivitamins containing vitamin A. Vitamin B12. Ensure the form and dosage are safe. Methylcobalamin is recommended. Vitamin E. Stick to natural sources to avoid adverse effects. Vitamin A. Avoid supplements to prevent toxicity. Vitamin C. Excessive intake can lead to kidney damage. Be aware of the right dosage to avoid serious health issues.